Go to aircoawesome.com or call 454-COOL.
Tens of thousands of Americans could require a bone marrow transplant this year because of blood cancer. It is a highly effective treatment, but until recently, the patients would need to spend up to a month or more in the hospital to recover from the debilitating treatment and what you go through. Well, thanks to new techniques and medications, many people can recover at home as outpatients. St. David's South Austin Medical Center is the first in our area to offer this, avoiding long hospital recoveries in places like Dallas or San Antonio.
It was shocking. Anytime you hear the word cancer, it's shocking.
Andrea Easter was diagnosed with multiple myeloma 2 years ago. She underwent multiple treatments of radiation and chemo, then surgery. But now she's had a bone marrow transplant at St. David's South and was able to recover at home.
We've come a long way. You know, when we first started doing them, we didn't know a lot, but now it's a very routine medical procedure.
The machine works something like a butter churn with cream rising to the top. In the case of a bone marrow transplant, it is the vital stem cells separated from the blood.
We put an IV in one arm, IV in another arm, and blood comes out of one arm, goes into the machine, and the machine has a little centrifuge, and it collects all the stem cells that we need for the transplant, and everything else comes back right to you through the other arm.
But it takes weeks for the patient's blood count to recover, and there is constant fatigue.
As you go through it, then you start feeling a little tired. You know, you're on a limited diet.
Oftentimes, patients were in the hospital for at least a month, sometimes longer. It's advances in drugs, advances in stem cell collection procedures, advances in our ability to care for them on a daily basis.
Andrea had to make daily visits to the doctors after her transplant, but it was just a few hours at a time. She could go home every night and recover there.
Seeing that I had been in the hospital previously for my surgery, it was really good to be able to know that I could go home. And even if I knew I had to come back every morning, still to go home and sleep in my bed and take a shower in my own shower meant a big difference. It really helped, you know, spirit-wise.
Well, you can imagine taking a closer look at bone marrow transplants for blood cancer. Some 20,000 people will get them this year in the U.S. Not all are treated as outpatients. There isn't always such a specialized clinic nearby, and it depends on the condition of the patient. According to the Seattle Care Center Alliance, they have an 85% success rate in cases of blood cancer.